And look up a little bit. There it is.
I didn't expect that.
Now, before we talk about your tongue, I know that's the biggest thing. These muscles are really tight, by the way.
Yeah.
But we have some neck and shoulder problems as well, right?
Yes.
Okay, and you said most of it's on the right side.
Neck and shoulder, both.
It's both sides.
Yes.
And then your lower back, and then you said you don't really, we didn't talk much about your lower back. You said it's more like in your legs and your feet, right?
Lower back is I can't sit for too long.
Okay.
Yeah.
Did we fall, or did anything happen to your tailbone? Because I know that was something that
Tailbone, I probably fell, there was one time I fell on the stairs.
On the stairs?
Yes.
Okay, like you fell on your butt on the stairs?
On the butt,
okay.
yes.
How many years ago was that, you think?
Within 10 years.
Okay.
Yeah.
All right. Okay, now the neck and the shoulders, that's been going on. You said you feel it on both sides, right? And I can tell you right now that left side, even though you're talking about both sides, this side you have a pretty big tightness, like a nodule in there. The right side, some tightness as well, a little bit right there, but that left side is a lot more.
Okay.
Now, now in terms of when you talk about your tongue, so you said it's kind of like a burning sensation, or is it more like a numbing, or is it both?
Both.
Okay. Now that's been going on, you said 3 years?
Yes.
Okay. Now, do you feel like it's the entire tongue, or do you feel like it's more one side than the other?
Entire. There's no one side or the other.
Okay. All right. Well, let's take a look here, and we talked a lot about this already, but the upper neck is where I'm going to be looking a lot for. A lot of times when we have patients that, like we talked about, like Bell's palsy, even like the numbingness of like the tongue, or weakness, or just sometimes the tongue, if there's a decrease in nerve innervation, when you stick out your tongue, it can go out to the left or to the right instead of going straight out.
Okay.
Just because there's lack of innervation going on. And so it's very common that a lot of times people search for a lot of different answers from different healthcare facilities. And usually they end up finding themselves in our office after they're like, I don't know where else to go.
Right? You want to find out it's not a health problem. I mean, right?
And
it's not
smart.
a disease or...
Yeah, anything that's very, very, concerning in the sense of, is there, like you said, another disease that we have to look for?
Right, or some underlying, just...
And I would say that's probably a very smart thing to do, is like, okay, let's get an MRI, let's get a scan, let's do something just to see, like, what's going on. But once we start clearing a lot of that stuff, like, okay, it's not this, it's not that, what else could it be? Likely we'll start to see, okay, maybe it's a nerve issue.
Right.
Maybe it's something going on with our spine. And so, so I'm really glad that you're here. Yeah, right there. Okay. All right, so again, I'm going to push on that right side. Here's the C1. And then here's that occiput right there. Any soreness right up on there?
Yes.
Yeah. Is it worse right down here or more up here? On the upper part or the lower part?
Maybe upper, but they both are pretty sore.
They're both pretty sore. Yeah. I'm going to tilt you over to the left. Tilt you over to the right. Yeah, that does not want to close down on that right side. So what I'm looking for is the gliding of that joint.
Okay.
And as you tilt your head to the right, that should glide, but it's not. So we're going to take a little bit further of that. And then we got that tailbone right here. So again, that's that S1. It's pretty sore there. Okay. So with the occiput, oh yeah, that doesn't move much at all. You feel like glides on that left side like that, and then up here, it just kind of like locks. So what I'm looking for is on the occiput, it should glide forward.
Okay.
Like this side, it moves pretty easily. On the right side, it kind of like jams. So that is definitely where we're looking at. So it should kind of want to push down like that. This upper joint on that right side, it should glide. But when it gets stuck,
it doesn't.
It's because there's a lot of inflammation that's preventing that from moving here. So if we can get that movement and push that joint down where it needs to be, that will help to reduce the restriction, but it will actually help to get movement in there to get some of the inflammation out of there. Okay? Alright, so all you got to do is just relax there. So I want to be getting up onto this occiput, this upper part of your neck here. And we're going to see if I can get some movement on this thing. But it's such a tiny little joint. It's going to take us a little bit of time here. So let's see what we can do here today. And all I got to do, I'm going to give a little bit of a push, just like this. Bring your chin up just a little bit. There you go. And as you relax that shoulder, a little bit just like that. And look up a little bit. There it is.
I didn't expect that.
Good. Oh yeah, that moved really well. There you go. This leg's going to be nice and straight.
Okay.
Alright, we're going to get that tailbone for you, okay? Alright, just right here. Relax the arm down. There you go. I'm going to roll you just a little bit. I won't drop you, okay?
Okay.
Alright. Rolling you just a little bit here. There you go. Relax that shoulder. There you go. Just like that. There it is. Good. Alright, come on up. Have a seat. Okay. How you feeling? You doing okay?
Yeah.
Okay, good. Yeah, no, that can be really good. Once we get pressure off of that occiput or the upper part.
I'm just trying to see if I feel like my body can breathe again.
We'll see how we do with that. Good. Good, good, good. Good stuff. All right. So let me go over what we did today. So we're very, very specific and very targeted on what we feel is the biggest issue. Now, I'm not just trying to get generalized manipulation or mobilization, so I'm really targeting where there's issues on the structure. So for you, again, this is your occiput. It shifted back and up. That joint is right here. When that joint gets inflamed, it's going to come up and it's going to get stuck. What I did was I shifted and I moved it so that way it gets pressure off of there, right? So because this one's moving well, I don't need to adjust it. It's because there's inflammation and restriction on that joint here, okay? And so that's where your head, as it rocks up like that, I shifted that back down, okay? Because I'm trying to get that pressure off of that nerve and allow that to start to function better, okay? Because that's where those nerves come up here. Then also you have those nerves that kind of come through that part as well. And so that's what I want to see how you respond to that, okay? The other one that we did was your tailbone here. Again, you have that disc, it's worn out quite a bit. So that tailbone, when it kind of shifts up like that and it sits back, I moved it forward so we can get some mobility and some stability underneath that disc here, okay? So you'll notice I'm very targeted. I only did those two joints. Because I'm only working on things that need to be fixed, and I leave the rest of the spine alone, right? Because if it's not broke, you don't fix it, right?
You don't want to touch it.
And so that's what we focused on today. Is one is the right side of your occiput, and then two is that tailbone right here. Okay, so let's see how you respond.
Okay.
You might feel some soreness just because we did get some movement on that. So if you feel that, that's to be expected. Ice is your best friend. Okay. 20 minutes every couple of hours. You can put that right up where we adjusted, okay? Same thing on the lower back as well. Okay.
I probably not gonna feel any. If anything, it will be better because I'm always sore and then.
And you get headaches and stuff like that. So again, I'm not just expecting some things to improve with what's going on inside. I'm actually expecting a lot of things to improve with your entire body. And so that is the expectation. Now it's just we did the adjustment. Now it's time to let it heal and see what we're going to be doing.
So every time throughout this course of 6 months, you go on. This is 2 areas you gotta work on.
Well, it's going to depend on what I see on the scan. If I'm starting to see improvement here, but I'm seeing stress down below, we'll work on that. But if I'm seeing stress in the mid back, we're going to work on that as well. So depending on how we're doing, because we worked on the occiput, that really stimulates what we call the parasympathetic system. The mid-back is much more involved with your sympathetic system. So we don't like to mix the systems too much. Sometimes we will, but for the most part, especially in the beginning, I want to see how you do with just the upper part and the lower part. We may work on the mid-back later on, but that's what we're going to focus on and then see how things do,
Perfect.
Well,
Thank you so much.
You're
very informative.
I'm excited for you. I think I'm expecting some good things for you.